Well, good morning, everyone. Thank you very much for joining today. It's an honor to be presenting, especially with Seven Directions, but also with the Intertribal Council of Arizona. I got my start in public health with ITCA, with the American Indian Research Center for Health back in 2000. So I always enjoy working with ITCA and just want to thank them for hosting the webinar today and for inviting us to talk about the Transforming Indigenous Governance to Improve Health resource that uses the framework called Becoming Butterfly. Just a little bit about Red Star International. We're a nonprofit organization based in Tucson, Arizona, but we're also co-located in New Zealand. And we have an international focus that is usually mostly based in the US, but also across the South Pacific, with the mission of advancing Indigenous self-determination for healthy and vibrant communities. And so while Tucson is home, my second home is in Tauranga, Aotearoa, New Zealand, and just want to acknowledge that I'm calling in from the traditional homelands of three Maori tribes, the Ngāti Ranginui, Naitirangi, and Ngāti Pukenga. And I'll go ahead and start our presentation. The main objectives that I hope to achieve today is, one, to introduce the Tribal Health Governance Transformation resource, and I believe that Danielle is going to drop a link to that resource into the chat at some point in our presentation today if she hasn't already, and to highlight the importance of cultural and political sovereignty in health governance. We'll talk about the importance of tribal public health authority and share an approach to increase legal competency in a way that aligns with our traditional cultural values and norms, and give some examples throughout as it relates to COVID. It's so much part of our reality for the past year, and it really has moved public health from being this concept that some people don't understand to really giving us a concrete understanding of the importance of public health and protecting and promoting our health. So I just want to start by acknowledging the Cherokee Nation. First and foremost, it was their funding through the CDC that supported the development of the Transformation Governance resource, and also the vision of Lisa Pivick, their public health director, senior public health director, who had a vision and saw the need for such a resource to help tribes, especially those looking to strengthen their public health authority. And in the process of developing the resource, we felt like it was important to check our assumptions. We had a lot of ideas about what public health authority is, what it looks like, how it's practiced in different tribal communities, and we wanted to ensure its relevancy in a variety of tribal setting and contexts. So we engaged representatives from Cherokee Nation, Chickasaw Nation, Eastern Band of Cherokee Indians, and the Pasco Yaqui tribe, and involved them at different aspects of the development of the resource. So I want to acknowledge them and their contributions. So why Becoming Butterfly? Transforming our health governance is a process of healing and reclamation that begins with understanding who we are as Indigenous people. So healing ourselves and our health systems is a cyclical process with recognizable phases that cannot be skipped. So just like the caterpillar transforms into a butterfly, each phase is necessary and prepares us for the next. And so the resource governance weaves two frameworks together to look at how we can transform or how we govern for health. The first framework is the concept of nation building or rebuilding, which acknowledges our sovereignty and the notion that our Indigenous nations have always been. And in this sense, we are rebuilding. And so these principles were developed based on decades of research conducted by the Harvard Project on American Indian Economic Development and its partner organization, the Native Nations Institute at the Udall Center for Studies in Public Policy. And so these principles really are based on the notion that our self-rule, first and foremost, exists in the hands of our tribal nations. And sovereignty alone isn't enough. That sovereignty needs to be backed with a competence, with competence and through that authority. And when that authority is put into practice, it's important that our governing institutions match our community beliefs about authority, and that when we make decisions, we do it in a way that is both strategic and focused on our long-term priorities, but is also culturally aligned. And so in this sense, leadership serves as a nation builder and community mobilizer that really puts our community at the center of all that we do. And so from that research, while the principles provide guidance for nation building, the research shows that tribal nations, when seeking to achieve development and nation building, there are three major tasks that they must do. One is about creating the conditions in which people can be healthy, and they need to do so in a way that's culturally aligned with the values and ways of life of the people, and they need to do it in ways that support genuine self-governance, independent of external definitions. And as a public health person, I look at that and I say, well, that's exactly the definition of public health. So when we're looking at governing for health, it really is about taking a public health approach to understanding our sovereignty and how we exercise it in protecting and promoting the health of our communities, but again, in creating those conditions in which they can be healthy. The second framework is the circle, and these are steps that were developed by Michelle Chino based on the gathering of Native Americans. And she had adapted the principles and cyclical nature of the GONA for capacity building. And so the circle acknowledges the relational process or aspect creating community-based interventions. And so we've adapted the circle for capacity building to actually transforming systems. And we've identified relational process indicators along the way. And so when we're thinking about any kind of transformation, but in particular our health governance, these relational indicators guide that work towards sustainable change, because we know that if we want that any transformation that we create to be sustained over time, it's going to require us to build relationships. And that's bringing people together, exchanging ideas and establishing common ground, and recognizing that each person or department or program has ideas and skills that they can contribute to an effort. And so how do we tap into those contributions and foster group decision making and create a plan to work together and move forward? And so that once we start working together, we're acknowledging each other's interdependence, we're identifying connections and opportunities to collaborate and coordinate. We're focused on solutions instead of just identifying problems, and honoring the contributions of each other. And from that place, we can celebrate our successes and promote commitment by both reflecting on our lessons and sharing what is learned with others. And so woven together, these models create a framework, the Becoming Butterfly framework, that translates the research into practice to transform health governance. So we've used the metaphor of a butterfly to talk about the transformation. And you can see here how the different models are woven together. So essentially within the first ring, you see the concepts of the circle going through each phase. And then we've used each of the principles to ground our discussion around health governance transformation. And so in the East, we start with sovereignty, move into how sovereignty is and governance is transferred into authority, legal preparedness, and then ultimately becoming butterfly, where we're governing from a community-centered approach. So I'll go through each of these phases and talking about some of the key elements that are highlighted in the resource. So starting in the East with sovereignty, it's important to first and foremost acknowledge who we are as Indigenous people, and that begins with acknowledging our inherent sovereignty. And as the original architects of systems, ways of life that have kept us healthy for millennia, we can look to our creation stories and other cultural narratives, our old traditions that have been given to us by our ancestors, to really guide us in the work that we're doing. And this is what has been shared with us across the generations that define our values, relationships, and our social norms. And these are essentially what make up our customary laws, practices, culture, language. All of that is deeply embedded into how we live and essentially provides a governing system of understood and enforceable law. They establish our relationship with the connection to the natural world. They outline our traditional territories. They help us understand who we are and where we are from and our connection to that land, but also our responsibility in caring for it and caring for one another. It speaks to all the different things that we might call social determinants of health, how we educate our children, how we relate within our family systems, our community systems, and across the tribe. And it really does also inform how decisions are made. And so I provide an example here of traditional governance provided by Sherry Mitchell in her book called Sacred Instructions for the Wabanaki. And so if we take a moment to reflect on the traditional governance of our tribe, or if we're not connected with an Indigenous community, we can perhaps reflect on some of the traditional governance of tribes that we've worked for or worked with. We can think about how we might look to this governance in our decisions as we go forward. Some tribes' traditional governance is still very much in place, while others it may not be as much, but there are still opportunities to look at different ways to integrate it into the work that we do. In this example, she talks about how when problems arose in the community, they were brought to the clan mothers. So in what ways can we go back to the clan mothers, for example, to seek guidance to address important public health issues? So while on one hand, we have our cultural sovereignty, we also have our political sovereignty. And that inherent sovereignty of tribes is recognized by the US Constitution. It's recognized in treaties, court cases, and legislation. That sovereignty gives us the right to form a government, define our membership, administer justice, and enforce laws, to tax, regulate domestic relations among our members, property use, and so on. And so when we think about critical legislation that has impacted our political sovereignty, especially as it relates to health, the era of self-determination really ushered an important time for us, where tribes and the subsequent legislation and amendments to that, but gave tribes the authority to manage services that were previously managed by the federal government, such as health, education, social services, and so on. And so from a health perspective, it really confirmed this concept of tribal self-governance as it relates to health. But in my mind, when we talk about self-governance tribes and direct service tribes, I think the term self-governance referring to one group versus another is a little bit limiting, because when we think about a public health perspective to health governance, we know that health extends far beyond our clinical walls, and that we've had increased public health activity and capacity in recent decades. And so self-governance as it relates to health is more than just the health care that we provide to individuals, but is how we protect and promote the health of entire communities. And we really saw this with COVID as an emerging public health threat. And that place really matters in terms of the social determinants of health, not only in terms of where one lives, but also in how well critical public health activities are coordinated within and across governments. And that's tribes, state, local, and federal governments. And so we've really seen through COVID how it's required a collective response from across departments within tribes, but also across governments. And so from this perspective, I want to sort of redefine our concept of health governance to be a bit more expansive, because if our ultimate goal of our political sovereignty is about protecting a way of life, which is our cultural sovereignty, then we have an opportunity to think more broadly about what health governance looks like. And we saw tribes use their political sovereignty very much to protect the health of the people on the reservation. And I'm going to talk more about that as we go on. So going forward, when we think of health governance, I want us, if we think about the sort of the vision and teachings of our ancestors becoming the reeds around which we weave our political sovereignty, then when we exercise that sovereignty in a way that holds our community's health at the center and at the heart of health governance, then what we've created is a beautifully woven basket that is community-centered and functional. And that function is to promote the health of our people. And we know that we don't go it alone. It takes collaborative work. It takes tribal leaders, administrators, staff, tribal attorneys, and the communities. And so it's not just the jobs of lawyers to strengthen authority or to develop tribal codes. It really does take an interdisciplinary team that brings a variety of perspectives and helps us understand what's happening on the ground and how we translate that into law. And we really want to get us into a place where we're working together like we have one heart. So with sovereignty as it relates to the framework, starting with the butterfly egg and the place of beginnings, it really begins with that practical self-rule that exists in the hands of our tribal nations. So understanding who our governing entities are, what is their authority, where does that authority come from, and then how is it exercised? So looking to our original documents, such as our tribal constitutions, our laws that we may already have, helps us understand pathways for exercising sovereignty in a way that is effective. And so in the resource, we've actually created a tool to map out what our governance looks like. So with this particular example of what a tribal governance and map might look like, you have a list of the different governing entities. It might include tribal council, the executive leadership through the chief, chairman, or governor. We might have a health oversight committee that provides general oversight to a health department. You may have a health governing board over your clinical services. And but our cultural societies or councils may also have a level of authority that may not be codified. And so by mapping out this process, we have a better understanding of where that authority comes from, what that authority is. And then if we take it a step further and discuss, well, how is this authority currently being exercised on the daily basis? And does it actually align with how the authority is defined within our tribal laws? And then in that sense, the tool can be used as an opportunity to better align how we're practicing that authority with how it's actually codified within our legal documents. And I want to point out, actually use an example of how this type of authority might come into play with COVID, and in particular, we may have tribal council pass a legislative act for social distancing, just for example, but how social distancing might play out in different tribal administration buildings. They might be able to lay that out, but what does that look like in ceremony? Does the tribal council have the authority to decide how that looks in ceremony, whether ceremony still happens during such a time as a pandemic? And then perhaps it's the ceremonial leaders who have the authority to make those decisions. And so how do we work with the different governing entities within the tribe to make really important decisions? So here are some different examples of governance functions that different legal entities might have. So once we're clear on those authorities, being really clear on what those functions are, then helps us understand how we can engage different governing entities at the right time with the right information when addressing important public health issues. So being clear about this helps strengthen our engagement and identify that pathway for addressing important public health issues, but how can these authorities and functions be articulated better? So once we have a clear sense of our sovereignty, our governing entities, who they are, their authorities, where that authority comes from, and that function, that authority needs to be backed with competence. And so from this place, we move to the from the egg to the caterpillar. And our tribal health departments have a really critical role in backing authority with its competence. But that authority must be granted. And so thinking about what that authority is, we need to think about our legal competence in terms of, do we have knowledge of our tribal law and what our legal role is within that law? So in that sense, a determinant of a tribe's capacity to exercise its authority really falls on whether or not that legal authority is understood. And one of the best ways to do that is to articulate it through codes, executive orders, or other legal means. So it becomes less about creating rules to follow, but making sure that we have those authorities defined in a way that really aligns with our cultural beliefs and practices that shape our worldview. Because when there's that alignment, then the attitudes and practices, not just amongst the lawmakers, but also amongst its citizens, also align. And so what is public health authority? Tribes by definition are public health authority. This is the definition provided by the US Department of Health and Human Services. And it basically includes the federal government, a state, a territory, and it includes tribes. Where it talks about a political subdivision of a state or a territory, it's really talking about local governments as being public health authorities. And the second definition is where a person or entity acting under a grant of authority from authority granted from or through a contact through one of these agencies. So in this second example, that's actually how tribal epicenters are authorities. That authority was granted by the federal government through the Affordable Care Act. And so we saw firsthand with COVID how tribes are exercising this authority every day. We saw it through road closures, closures of economic enterprises such as casinos, closures of tribal offices, all in response to the federal government, all in response to the COVID and in an effort to protect the people of the community. And so that's one of the key reasons why public health authority is so important. But our challenge is, is that tribes are not always fully integrated into existing surveillance systems or public health response networks. And so it becomes really important for tribes to articulate that public health authority. Our communities may be at increased risk by not being included in those networks. And when we are too centered around our healthcare services and we're not investing in our ability to respond from a public health approach, it can make us more vulnerable. Adrian Dominguez from the Urban Indian Health Institute on the last webinar for Gathering Grounds talked about the challenge around getting racial data for American Indian Alaska Natives and really understanding what the data actually looks like for our communities. And then it becomes especially challenging when that public health authority is not acknowledged or respected by external governments. And he talked about that as an example with the tribal epicenters, when that data is requested and it's not given to them because they're not respecting them as public health authorities. And the same can be true for tribes. And so it's really important that that public health authority be articulated. And so we provide an example in the resource of what a tribal public health code might include. And so this here is a checklist of examples of elements that a public health code might include. And so tribes can look at what public health code they might have, or they might have some type of code in place. They can use this as a checklist to guide discussion about things that might be missing from the code that they might want to consider adding. Or if a tribe doesn't have any kind of code in place, this can be a place to start. But along with this checklist, I've included a link to a model state code for public health, and Cherokee Nation was actually on the advisory board for creating this back in 2003. And so while it was a long time ago that it was created, it's still very relevant. But we've also provided in the resource some links to other resources where you can learn more about creating model codes. And so what happens when public health authority isn't respected? We saw this with South Dakota, where the state governor was really going after tribes and challenging their authority. And in doing so, really putting the tribes there at risk, saying that they need to remove those blocks. And so I think it's really important that while we have inherent sovereignty and we are public health authorities by definition, it often gets challenged in a lot of different ways by outside entities. And so through education, through understanding, through communication, states can hopefully get to a point where they understand that authority and they're respecting that. And here's an example of something that the South Dakota government put out just about a month or two ago, where they're actually respecting that authority and educating the community at large, not only about the checkpoints that the tribes have set up, but why they've been set up. And that is to protect their residents from COVID-19 exposure. So here are some different examples of authorities. And when these authorities are articulated or codified by some type of legal document, it does make it easier to interface with local and state authorities. So we know that public health emergencies like COVID do not know borders. And so being able to partner on a variety of different authorities becomes really relevant. The chairwoman, Lee Gatewood from the White Mountain Apache tribe, she discussed how they've been working with their partners, the Indian Health Service, with the Johns Hopkins University, and they discussed how they work together as partners in emergency response. So it's not necessarily that the tribe has to be the one that's doing it all, but that they can look to their partners through formal legal agreements such as MOUs, or work with other tribes. That's another example, but I was going to say work with state health departments to say, we are going to grant the state authority to do X, Y, and Z within our community. All of that is an act of sovereignty, but also it doesn't just assume that states can have certain authorities as well. It's also the opportunity for tribes to say to the state, you may have our data, but we do not authorize you to report it. So it's really an opportunity to articulate some of these different things. And the Native Nations Institute also just came out with an article linking to some tribal codes on these various topics. And we've also highlighted different resources that you can tap into in our resource. So once we've gotten to a place where we understand our governance, we've articulated our authority, and we've given our health departments the authority to act on behalf of that sovereignty to protect our people, we then go to a place of transitioning from legal competence to preparedness. And it's just like the chrysalis, where now defining our practice through statute, and we're doing it in a way that's, one, culturally aligned, but also very strategic and with the long-term focus in mind. And so we're not only just enacting laws, but we're actually investing in a qualified and competent workforce within the tribe and looking at ways to better coordinate and collaborate within the tribe, but also with external partners. And so what we've seen with the COVID response is all the different opportunities to learn from tribes. And every time I see articles like this come up, I'm always kind of like, well, why are you surprised? Of course, we know how to take care of our communities. Of course, we know how to reach them and how to do so most effectively. And it can be as as much in terms of mitigating the disease, but also in smaller ways. And I liked the example that Chairwoman Lee Gatewood shared on the last webinar about the power of language to create behavior change. They were having challenges getting people to follow the mask mandate. And so she used an Apache phrase that translated, as my understanding from what she shared, that actually translated into take heed, be watchful of over yourself, take care of yourself. And by putting those words onto the mask, the concept of wear a mask had much deeper connotations because it used their language and all the values that were connected with the phrase that was used that moved people to create change and to wear their masks with a sense of pride. And so getting to a place of looking to our language, our culture, and our values in developing laws can be challenging on some of the other bigger practices that are more far-reaching in terms of how we're mitigating a disease or conducting surveillance. And so we created, adapted a tool from a resource from the Value in Water Initiative. And this was used to create water policies, and we've adapted it here in the resource to look at different public health laws. So in this one, it's an opportunity to identify a specific law topic. Here I've put Public Health Authority in the upper left corner. And on the side, I've put different aspects of Public Health Authority where our values may come into play. And it gives you an example of how you might look at each of these different aspects through a variety of different lenses. So looking at our cultural values around health or around our authority, our social values, economic, environment, our relationship to the environment, and governance. And so with COVID, we saw firsthand where tribal leaders and all governments were tasked with the challenge of making really important decisions around their COVID response that had economic impact, it had social impact, and it also had cultural impact. And so it becomes challenging to have to weigh one against another. And so using a tool like this can help facilitate some of that discussion, perhaps not in an emergency, but when we're not in emergency and we're developing laws, we can really take that time to reflect more deeply on some of these topics. And I think that being based in New Zealand and having experienced COVID in New Zealand, I got to see firsthand the difference between what was happening in the US versus New Zealand, where our government here took very swift action and we went into a national lockdown. We couldn't go anywhere other than to the grocery store. And it had a huge economic impact. But the leadership at the time felt that it was more like, if we go hard and fast, take the economic hit, we'll be able to protect the health of our community, and then open slowly back up. And so those are just value decisions, and some people are on board with that and some aren't. But those are the types of decisions that we're being challenged with. And so how do we go from talking about creating tribal health codes to actually doing it. And so we provide a few, an approach that tribes can use. And I think it begins first and foremost with information gathering. What are some of the best practices for addressing the public health issue that you're looking at? Looking to the research, researching model codes from other tribes, looking at state codes, local government codes, looking at what resonates from in their codes that you think are strong elements that align with what is needed within the tribe, but also looking internally. What are the existing laws, policies, procedures, ordinance that currently exist? What is working? Where could that law be strengthened? What can we learn from the best practices or other model codes that might help us strengthen it? But also talk to our elders, look to our ceremonial people. What knowledge do we already have? What can we learn from addressing pandemics in the past? We've been around, we have that knowledge. What can we learn from those who hold that knowledge? And then assembling an interdisciplinary team who has knowledge on the topic. So any public health issue, we worked with a tribe that was looking to develop a code for addressing a vector-borne illness. And they brought together their attorney, the health department, the environmental health department, which was actually outside of the health department. They brought in representatives from CDC and also from the state and the Indian Health Service to all understand how is this issue affecting our community. And we actually used sticky notes to create a flow chart and map the current processes for addressing the vector-borne illness, and use that as a way of saying, where are the inefficiencies within this process? How do we need to improve in it? How can we streamline it? And then use that as the basis for developing a code, along with the information that we had gathered from other model codes and what other tribes and state health departments were doing. So meeting with your team, looking for legal guidance from your tribal attorney, engaging your tribal leadership in the process, making sure that they have the data and information to understand the public health issue, making sure they have the information of, if we do not act, what is going to be the impact on the community, and then crafting a code that gives clear delineation of that public health authority, what the roles and responsibilities are for the governance, but also for the implementation and putting it into practice, is one way or approach that a tribe can take into creating a public health legal framework. And so becoming Butterfly is really based on this premise that with sovereignty upheld and our authorities defined, and that our public health practice is backed by competence and is culturally aligned, that we can, that we really need to then center our investments into the community. So in this sense, our leadership serves as a nation builder and a community mobilizer, and working with community to help them understand why these public health laws exist, why they're important to follow in protecting all of our health, and then looking at how we invest in our public health. One of the challenges is that healthcare and public health are incentivized very differently. And so, you know, we know with healthcare, we have cost reimbursement, and we have a lot of different ways that services can be reimbursed. But with public health, we tend to rely largely on grants. And so tribal investments become really important for really being able to expand our capacity in that way, but also leveraging our partnerships, both internally and externally, is another opportunity. And we need to seek opportunities to align our services across multiple sectors and domains of our work. And so I'm going to focus just a little bit more on the investment aspect of the work, because I think it's really important, especially with the CARES Act and the funding that is coming with that. So in some of our work, we've recognized that tribal public health for decades, or Indian health in general, has been very program focused, very disease focused, and focused really on a tribal program delivering specific services. And this compares very differently with the national public health system, which for decades has been, the federal government has really invested in building their systems approach, their capacity to better network themselves, to look more at processes versus products. And so when we think of an example of that is, rather than just creating reports that just show the data, taking that around a specific health issue, actually building a process for using that data to then understand a health issue, develop health improvement plans, then analyze the impact of the plans that we're doing. So creating an entire process, the surveillance system essentially, for addressing health and understanding our impact. It also has focused on building public health authority with local and states, where a lot of our investment has focused more on facilitating tribal consultation between tribes and the Indian Health Service. And while all this is really important, it is really important too that we expand that and take more of a systems approach. So rather than just focusing our funding on cancer or diabetes, we're actually looking at how we address chronic disease and our capacity to address chronic disease as a whole. And so diversifying investments, some different strategies that a tribe can take is that we need to align our grant making and our investments on our strategic priorities. Oftentimes our grant seeking just, oh, here's a grant for tribes on this particular topic, and we pursue that. And so rather than letting what grant funding is available drive what work we do, we actually look for grants that are going to support our priorities that we've identified internally. And we want to get to a point too, where the things that we want to achieve, the performance from a public health perspective, that the budgets are done in a way that supports that performance versus the budgets driving what we do. And I hope that makes sense. We want to diversify our funding sources and not just go after grant opportunities that are specifically designated for tribes, but also look to other funding sources, private grants, private foundations, donors, other types of investments that we might look at that can give us a bit more freedom and flexibility, but also, again, like I said, can be more aligned with our strategic priorities. We also have an opportunity to leverage our resources across departments or programs. I know that gets tricky with federal funding. And so by diversifying our resources, we have a little bit more freedom. But we really do need to look for opportunities to invest in our capacity, in our infrastructure, but also in our workforce. And so when we think about the CARES Act and how some of that funding might be funneled, perhaps hiring epidemiologists, getting new software programs that help us create dashboards to be able to look at health data from across, and becoming more self-reliant in understanding our public health issues and what's happening over time, and identifying trends. So in summary, this image here reflects the concepts of the resource that are presented, taking tribes through the phases of the Becoming Butterfly framework. And so depending on the capacity of different tribes, they may move more quickly through some phases than others, but it's not at all meant to be prescriptive, but to just provide some landmarks or for consideration along the way. And the resource includes a number of different templates and activities to just guide discussion. There are links to resources. And for tribes that are thinking about public health accreditation, which also has standards for governance, for engaging our governing entities, for articulating public health authority and putting public health authority into practice, whether you're pursuing public health accreditation or not, it's one place where we can have a set of standards that we can look to, and there are tribally specific support in the FAB standards and measures, tribally specific. The measures are the same for state and local, but they're articulated for the tribal context. And so this is another resource that we can look to. So in summary, what we've done is we've identified a number of different activities that a tribe can go through at each phase of the process of building relationships and to strengthen sovereignty and governance, for building skills around exercising public health authority, strengthening legal competency and doing so in a way that's culturally aligned, moving from legal competence to legal preparedness and working together in our implementation and in a way that's very strategic. We're investing in our workforce, we're coordinating our services, and we're sharing information about our practices. And then we're moving to a place where we're promoting commitment and doing it across multiple domains, multiple authorities, and really investing in our public health strategies and effectively engaging leadership in that process. And so developing law and policy and transforming governance can be really challenging. And, as a formal tribal administrator, it can take years to get through these different phases. And I think that it's really important that anytime we engage on any type of process like this, that there can be a lot of different ideas about how to get there. And I think that it's really important that as we navigate those differences, that we seek to understand, what is motivating people to see one pathway and others to see another. And we have to remember that in conflicts that may arise, that we all have our community at heart. And so we just have different ideas about how to get there. And hopefully some of these relational indicators that we've identified can help you sort of think through some of those challenges. Because one thing that I think really resonates with me in understanding the phases of the butterfly is that when a butterfly is about to emerge from a cocoon, it really has to use its wings to break through that cocoon. And if it didn't, it has to go through that in order to be able to strengthen its wings in order to fly. So if it didn't go through that challenge and that struggle to break free, it wouldn't have the strength to fly. And so I wish you all well on your journey to transform your health governance, and just thank you for the opportunity to share the resource with you. So I'll end there and turn it back to Seven Directions.
Thank you so much, Alina. We really appreciate the opportunity to hear from you today. I'm just going to give you a virtual clap. And so everyone, please join me in thanking Alina. She's going to be available now for another 30 minutes to answer questions and respond to any comments that folks have. So we welcome you to stay on. I know one comment that Alina made. Hi, Alina from ITCA. She said that public health dollars through the Indian Health Service are provided through just a few line items, which is a really narrow focus, especially if you're a direct service tribe. Maybe we need a revamping of this approach, as you've discussed, Alina. I don't know if you have any comments related to that.
Yeah, so that's, I think, why the nation building concept and tasks are really important, because we can't just define our health governance and our health authority around the Indian Health Service line items. And so we've got to think about it more broadly, because even those direct service tribes that are looking to the Indian Health Service to fulfill some of that public health responsibility, at the end of the day, when we have threats like COVID that are impacting our entire communities, it's the tribal leaders that are going to take action around roadblocks, And, you know, I know for many communities, it also started with the community itself getting out there and creating those roadblocks. But it's just kind of expanding our thinking around health governance to be broader, and to be inclusive of our community-based programs that are looking at addressing the health of all of our communities. And but also, you know, holding the Indian Health Service accountable. They weren't it wasn't created to really have that public health function. It was much more created to contain and mitigate disease. And so I think we also have to continue to challenge them, as you have suggested, to rethink the public health aspect of funding. I was really excited to see Biden also contribute more money than we've seen in a really long time to all of our Indian health programs across, because all of the Indian Health Service we know is severely underfunded as well. So it has to really narrow it down and focus. But at the end of the day, the tribe's going to have to take action to protect our health. So I think you raise a really good point. Thank you for that.
Can I just follow up, Alina and Myra? It's so good to see you.
It's good to
Across
see you
the
too.
oceans, across the hills and valleys.
Yes.
But, you know, we did things like SDPI, and we got that mandatory funding. I mean, we've done things beyond the Indian Health Service, and of course, other agencies are involved. But when I listen to the tribal health directors, you know, they're orchestrating, trying to orchestrate all of these resources and, you know, produce something like a health system and a public health system. And then, you know, they have all these hoops to jump through, you know, the self-governance process and so forth. I guess it's just not easy enough for federal agencies like the CDC to provide resources to IHS so that it's more available within a more adaptable system that we're accustomed to. But I guess I'm trying to think about going from here, you know, what would be helpful, because, you know, each of those federal agencies end up having their own process, which, as you know, it's difficult to access all of those resources through each individual process. And it just seems like we're more familiar with IHS and with 638. But I don't think federal agencies want to provide resources to the Indian Health Service for that to occur. It's just a never-ending question. I guess there's really no answer.
Yes. And I would agree with that. And I think one of the things, and I forget the name of the mechanism, but I think that CDC, through some of its grant funding and funding that Seven Directions is currently managing, is looking at building tribal capacity in public health. And Myra, I don't know if you want to speak to that a little bit.
Yeah, and actually we have some CDC folks on the call, so I don't know if anybody would want to speak to that and follow up, but it's through the use of cooperative agreements, which provide a mechanism to work directly with tribal governments. So we haven't received a cooperative agreement. We're not eligible at Seven Directions, but the National Network of Public Health Institutes received a cooperative agreement to help support some of the tribal public health capacity development projects and other related projects funded by the CDC. But tribes and tribal epicenters are eligible to receive these cooperative agreements. And so I know Intertribal Council of Arizona, for example, has received one, maybe a couple under that mechanism. And I totally agree with you, Alita. There isn't necessarily at the federal level a good way of kind of devising ways to get these dollars out to tribes effectively. So we saw that, you know, last year when, you know, the federal government was funding the COVID response efforts, and they didn't have a process, to get the dollars out to tribes. And I think, that's kind of reflective of, the fact that tribes are a very unique, entity, and they have this government to government relationship, with the federal government. And at the same time, it's not necessarily very clearly mapped out across all the federal agencies in a very similar way. They rely on Indian Health Service and the Bureau of Indian Affairs and Bureau of Indian Education and kind of these long-standing, federal arms who interface directly with the tribes and provide those types of funding. But it's something that's newer to the other federal agencies. And so they don't necessarily have that same kind of relationship and same kind of mechanisms in place in order to make that happen in a very timely way. So I totally, agree that that is a major issue, especially if, we're looking at health from a holistic perspective, and we're trying to kind of knit together all these different funding sources in order to be able to address social determinants of health, like education and poverty and all the other things that are, facing Indian country. So I want to go ahead and just remind folks that there's a feedback form that Danielle put in the chat. You can click on that and provide a little bit of feedback to us. We take it really seriously. We like to hear from you, so that we can learn about what we can do better next time, or what worked really well, that we can continue to provide. And then I also wanted to open it up for other questions for Alina, since we have her here from New Zealand right now. I think it would be really great, to hear from all of you and see if you have any other comments or other things that you would like to ask her about with regards to the governance presentation that she provided today. I guess one thing, Alina, that I would ask you, you talked a little bit about your role as the education director for the Pascua Yaqui tribe. And I know that a lot of the work that you do is really informed by a practice-based approach. And I wonder if you could speak to that a little bit more and describe how that was an important, experience for you in working on this governance material.
Yeah, well, so I was the education director for Pascua Yaqui 2003 through 2007. And at that time, Chairwoman Herminia Frias was charged each of the departments. We went through a tribal-wide process of establishing all of our departments and our authorities. And so we worked with our tribal attorneys and developed our, essentially, we talked about the public health code. I did it for education. But it was essentially the same process that you would go through to develop a tribal public health code and create sort of the mission and purpose of articulate it through the law. And so we established our departments, and then within that, it became sort of the umbrella for all other policies that we created. So there were other policies that we then worked on to develop it. And we worked with multiple stakeholders to understand the issues. Same thing that I kind of described with the other tribe that we had worked with through our work with Red Star. We used sticky notes, at least for our department. That's what we did. I guess, my background first and foremost is as an educator and then going into public health. But I think as a teacher, the more hands-on we can use with our learning. And so that's where actually using sticky notes to flowchart our processes really helped us take a policy that we had that was so cumbersome, so challenging for community members. And when we did that process, we realized we had 27 different handoffs, and we were able to reduce it down to 10. And so it helped us streamline a process. It had impact on community. And so I think we had that same experience with public health practice as it related to the vector-borne illness. So that experience really helped me to see firsthand how establishing a tribal code and then building articulating your authorities in other areas underneath that can have a positive impact on your work. And it gave people, the staff, the guidance they needed to be able to do their work on a daily basis.
Thanks so much. It's really helpful to hear, what kinds of things work, really well, and different approaches that others have used in the past that are, helpful in shaping some of these processes that, need revision and revamping. So that's really great to hear about that and that approach and how you used it to kind of learn from it and see, how we might be able to replicate it in other settings. Thank you so much, Teresa, for dropping the link to the cooperative agreement information in the chat. Hi, Dr. Ritchie. Thanks for being able to join for the discussion period. We appreciate you being able to drop on. We were just talking about kind of practice-based approaches to continue to strengthen governance and how that can kind of fit into the model of governance that Alina was talking about today. And so I want to open it up to other folks to see if there's any questions or comments that you'd like to pose to Alina while she's with us this morning or afternoon, depending on where you're at in the country or the world. Okay, well, I know folks are busy. I know we have a fairly small group now. I just want to thank you again, Alina, for taking the time to provide